Hello there, viewers! Welcome back! Imagine having a good night's sleep when you feel a sharp pinch at your toe. It's a mouse! Out of the 2 million animal bites that occur every year in the US, mouse bites are responsible for 1% of them. If left untreated, rodent bites can lead to bacterial infection, changes in the kidneys or liver, and may cause pneumonia. Mice aren't aggressive by nature, but if they see a threat, they'll bite. You're most likely to get bitten while handling a mouse. Usually these bites aren't serious, but the main problem is infection, because they're carriers of deadly viruses and bacteria. If you're looking for ways to manage a mouse bite or are just curious to know more about it, then here's what to do. Number 1. Wash and soak the wound. Prevention is better than a cure. Now that you've been bitten, you're going to have to put a full stop to the spreading of infection. And quick! Wash the wound thoroughly under running water for at least 20 seconds. This will inhibit the spreading of disease like tetanus. Proper cleaning of the affected area plays a major role in overall prevention of infection. You can also soak the wound with a cloth dipped in warm water. You can also use salt water. It's kind of like soaking your dirty dishes in warm water, but the intention remains the same: to stop the bacterial infection. A salt water soak will sting, but it's worth it. Salt water has some amazing benefits. Have you tried some DIY pain reliever involving salt? What about Himalayan salt? Let's get the comment section going. Number 2. Cover your wound. You don't want to leave your wound open, as it'll increase the chance of infection, and that will make healing more difficult. The best way to close it up is by applying antibacterial ointment and then wrapping it in clean, sterile gauze. To avoid irritation of your skin, remember to clean away all the soapy water. You should only cover the wound if it has the possibility of getting dirty or scraped. If the bite is on a part of your body that doesn't get touched a lot, like toes or fingers, then you don't have to gauze it up. Leaving the wound uncovered results in a quicker recovery since it remains dry. Number 3. In case of bleeding. A little bit of blood may make you nervous, but there's no cause for alarm yet. Calm down and see if the blood is flowing freely or lightly. In case of light flow, press around the wound to make the blood ooze out. We're not being gross, there's a reason. It's to clear out any toxins or infectious bacteria. Squeezing out the blood sounds icky, but it's an important step during most animal, rodent, or lizard bites. The intention is to minimize the spread of a potential venom or infection to the rest of the body. After doing this, be sure to complete dressing the wound with a clean, sterile pad that will apply pressure and secure the blood. Number 4. Pain relief medication. If you look at the mouse bite closely, you'll see it looks like 2 tiny holes from the rodent's razor-sharp teeth. Since this injury will be extremely painful, you can have a painkiller after consulting your doctor to be on the safe side. They might recommend ibuprofen to get rid of the pain. Mouse bites can hurt really badly since these rodents have strong front teeth that can break through your skin. Look for early signs of increasing infection. Keep an eye on the bite to see if there's an infection and whether it's increasing or not. Symptoms include: pain keeps getting worse instead of better as expected. You start developing a fever, which is never good news in case of infections. Redness developing around the wounded area. This means that the infection is spreading gradually. Bloating up of your lymph nodes is another indication of growing symptoms. This may occur on your neck, armpit, or groin region. The affected area feels tender when you touch it. When to seek medical help. Did the rodent just scratch you or did it bite you? Was the bite intense or light? To be completely sure and to eliminate all possibility of infection, it's vital for you to go see a doctor ASAP. After cleaning the wound, applying ointment, and dressing it, head over to the nearest doctor. Another sign for you to go see a doctor is if you notice that after 3 days, the wound is not healing like it should. Do not try any homemade DIY treatments or medications. This means that the dressing and ointment is not working, and maybe you need some medical attention. Rodent bites can easily result in serious infections, like rat bite fever, if not taken care of in the early stages, especially if the person involved is a child or an elderly individual. The doctor may give you a booster shot for tetanus. Rat bite fever things to know. So, a mouse bit you. You have taken all the preventative measures required and are now contemplating if you have rat bite fever. Was the mouse infected? If not properly managed in the beginning stages, rat bite fever, or RBF, can cause serious illnesses including liver problems, adrenal gland failure, meningitis, and more. Don't worry, we're going to tell you exactly what the symptoms are. The symptoms usually kick in after 3 to 7 days of being bit or coming in contact with the infectious bacteria. However, every person reacts differently to this, so the symptoms may even take as long as 3 weeks to develop. Some visible symptoms may appear in the form of rashes or tiny flattened red bumps on your hands and legs. You will also experience swelling in one or more of the joints, which are painful when you touch them. Severe vomiting and sore throat are also indicative of a rapidly increasing bacterial infection in your body. Do you think your immunity has lost its gusto? Is it affecting your overall well-being? Learn more about 7 ways your immune system affects your mind and body. Now let's get back to what to do if you're bitten by a mouse. How to get rid of mice at home. Getting bit by a mouse could mean that your home may need some intense cleaning and clutter reduction. Mice thrive in closed spaces and multiply like there's no tomorrow. Before you know it, you're housing a horde of mice. They'll not only destroy your stuff, but will also transfer bacteria and infections to you and your family. The first time you spot a mouse running around, you'll have to act quickly. Here are some ways to eliminate mice for good. Number 1. Block all the entryways. Think like a mouse and block all the entryways, like a broken part of the wall or some old pipes. Recognize these spots and seal them shut with the help of steel wool and caulk. Even if it's just a tiny hole, make sure it's sealed. Number 2. Use humane mouse traps. This is one of the classic ways of stopping mice infestation in your home. People generally underestimate a mice infestation, but it's a serious issue. Setting up a humane trap will allow you to catch the mouse and then leave it in the wild without hurting them. Number 3. Declutter. Don't get fooled into thinking that sanitizing your home will drive the mice away. It may help to some extent, but remember that rodents are attracted to poor sanitation situations. Keep your floors clean and get rid of anything you may not use and clear out unnecessary items. This is one of the main causes for rat infestation. Number 4. Regular pruning. Branches and shrubs tend to act like a highway for a mouse to enter your homes. Get rid of all the extra bushes, branches, and shrubs that have overgrown. Don't put it off until tomorrow, since it may be one of the prime reasons the rodents are in your home. Have you ever been bitten by a mouse? Did you seek medical attention? Comment below your experience. You never know who you may be helping. Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait, what kind of bestie are we if we don't tell you about our other awesome videos? Go ahead, choose the left or right video, and enjoy.